Alright, this patient is a little difficult to deal with, but we're going to try. So scene safe, PPE, MOI, NOI, number of patients, I'm going to say 1. Additional resources, I'll call for fire, PD, and ALS. I'm going to defer C-spine. General impression, I see a 50-year-old female sitting on her couch in her home, holding her chest with her hand. Like that. And then AFPU, hi ma'am, she's alert. What seems to be going on today? She says she has chest pain that started about 15 minutes before she called us. All right, do you have pain anywhere else? She says in between her shoulder blades. All right, have you had pain like this before? She says no. So I'm going to do ABCs. I'm going to check the airway. Is it open? Is it clear? Right, I'm going to do breathing, so I'm going to get rate, rhythm, and quality. I'm going to auscultate. And at this time, I'm going to defer oxygen. I'm going to do circulation, so RRQ, cap refill, TTC, and then I'm going to defer a blood sweep, and I'm going to do non-priority on this patient. We're going to get in the truck, and then I'm going to go through samples. So any other symptoms that you're having? She says no, just the chest pain and the pain in between her shoulder blades. All right, do you have any allergies? Not that she knows of. Do you take any medications on a daily basis? She says she just takes a medication for high blood pressure. She doesn't know the name. Any prior medical history, anything you've been diagnosed with besides the high blood pressure? She says no. What did you last eat or drink? Oh, an hour ago she drank a Coke. All right, and what were you doing before this happened? She says she was just laying on the couch watching a movie when she had the chest pain. I'm going to get vitals, so I'm going to get blood pressure. I'm going to get SpO2, BGL, pulse, and respiratory rate. And then I'm going to do OPQRST, so onset 15 minutes before she called us. Does anything make the pain better or worse? She says not really. It just hurts all the time. What would you describe the pain as? She says it feels like an elephant is sitting on her chest. Is the pain radiating anywhere else besides in between your shoulder blades? She says no. And then what would you rate your pain on a scale from 1 to 10? 10 being the worst pain you've ever felt. She says above a 10. Alright, and the timing we already know. Alright, ma'am. So you say you take a medication for your high blood pressure. You don't take anything for chest pain. She says no, so she doesn't have a prescription for nitroglycerin, which is a requirement. And then if she did have a prescription, I'd have to see if she took ED meds within the past 24 hours, and if her systolic was below 100, I wouldn't be able to give it. So because she doesn't have a prescription, I'm going to administer 324 milligrams of aspirin, which is 4 81 milligram tablets. I'm going to chew them. Alright, ma'am, I'm going to give you a medication that's going to make your chest pain a little bit better, alright? You just have to chew these pills. 1, 2, 3, 4. Alright, time goes by and her chest pain improves. So, give me paw. Give me paw.